Welcome to MedQuacks. Our disclaimer, we are not doctors. The dialogue here is a discussion between two friends with very different backgrounds, sharing our opinions on various medical conditions. My name is Troy, and I'm an acupuncturist, and my buddy Doug is a pharmacist. The medical information presented here is merely information, not advice. If listeners need medical advice, they should consult a doctor or other appropriate medical professional. My suggestion? Someone who is not a quack.
So I'm sitting here in my shop today, and I want to do a short video on sleep positions. Specifically, how you should properly sleep on your side. There's all kinds of advice out there as far as using pillows and how to put pillows between your knees and how you should have a pillow that's the thickness of your shoulder so that your spine stays completely neutral and straight, and even how you should have a pillow to wrap your arm around. And this advice that they're giving people out there as far as trying to keep your spine straight while you sleep is absolute quackery. It is not the way you're supposed to sleep. In fact, it will cause you more harm. It will give you more body pain. It will contribute to knee pain. It will contribute to neck pain, hip joint pain, as well as shoulder joint pain. And I'll explain why that is and how you should actually be sleeping in a rotated position. If we look at the vertebrae, in between these vertebral bodies, you have the intervertebral disc. The outside of this disc is called the annulus fibrosus, and the inside of the disc is called the nucleus pulposa. It's basically a very durable jelly donut. That soft inside is hypertonic. Via osmosis, it draws fluid into the inside of the disc. And even though we get permeability with osmosis, it's not really vascular, which means it doesn't have blood supply moving in and out of it like your muscles do. It relies on what we call collateral circulation, blood supply around the disc. So there's lots of blood supply around the disc this way, as well as on the actual end plates of the vertebral bodies. So there's circulation around the disc, but not necessarily through the disc. You'll see these small areas here, these articulating surfaces, and this is called the facet joints. Now the facet joints, it's the small articulating surface in the back. You have a superior articulating surface and you have an inferior articulating surface for each vertebrae that are stacked on top of each other. Now these facets stabilize the spine, but they do allow a certain amount of rotation to happen. Now when you look at the facet joints, they're angled, like if we look at the cervical vertebrae, these facet joints are angled at about 45 degrees, which allows a lot of rotation to happen at the cervical spine because the angle is very low at 45 degrees. As we move down into the thoracic spine, this facet joint angle increases and rotation becomes more limited. And then when we get down here into the lumbar spine, these facet joints are almost at a 90-degree angle. Now, even though within the lumbar vertebrae, these facet joints are very steep, almost 90 degrees, and there's a small amount of rotation here, say 2 to 3 degrees. Now, that doesn't sound like very much axial rotation, but there's a coupling effect that happens. That when you get a smaller rotation here, you get rotation above and continuing up the spine. And so when you add all of those subtle rotation angles together, you get a pretty significant rotation because of the coupling effect. The other thing that's significant is because there is an angle, an upward slope, if you will, of these facet joints, when this rotates, even that small amount, the vertebral bodies actually lift. And so this, as it rotates, will lift up slightly. When it does, it pulls on the disc. And so it's decompressing the disc. As it rotates, it separates slightly from the vertebrae below, and it causes a negative pressure here in the disc. That's what also helps draw fluid in there via osmosis. And so these facet joints, even at the lumbar level where they don't rotate very much, that small amount of rotation can cause a negative pressure in the disc, help pull fluid in there, and help expand and distract that disc. When you do that, it's going to create, with movement, it creates almost a pumping effect of the disc. And that's going to help improve circulation in and out of the disc. It's going to supply more nutrition in and out of the disc, as well as waste removal from the disc. You can look at that rotation as a way to distract that disc. So if you go in, you hear about inversion tables, for example, where people hang at a 30-degree angle or so to stretch the spine and reduce maybe a bulging disc or something like that. That is what distraction is. But your body naturally does that, to not to that significant degree of, say a traction table. But when you do rotate, you do get some traction in that disc, which means you expand that disc a little bit. At night, when you're laying horizontal and you don't have gravity pushing on you and you're well hydrated, the osmosis and the movement of fluid in the disc will actually cause the disc to swell some. When you wake up in the morning, because of hydration of your discs, you're actually about a 1/4 inch taller in the morning than when you went to bed. We also get interesting movement within the thoracic intervertebral discs, and that happens partly through respiration. So as our ribs elevate, and because our thoracic vertebrae articulate with our ribs, rib movement will also affect the intervertebral discs, and that will aid in the health of those discs. So deep breathing exercises, for example, can actually improve the health of the discs. Do's and don'ts when you sleep on your side. The main don'ts is that you do not sleep directly on your side with a neutral spine position. Because what that does, when you lay directly on your side, you are putting pressure directly on your shoulder joint as well as your hip joint. These areas are not meant to support your body weight. Imagine taking the humeral head and you're shoving it into the glenohumeral joint of the shoulder, and you're compressing that joint in there for hours at a time. If you're laying directly on your shoulder, you're not getting lubrication of that joint. You're not getting good nutrition of that joint. You're squeezing fluid out of that joint, and you're compressing that cartilage for hours and hours at a time. You do the same thing for the hip. If you're laying directly on the hip, you're taking the femur and you're shoving it into the acetabulum of the pelvis, and again, you're compressing that joint in such a way that it decreases nutrition into the joint, it decreases lubrication into the joint, and it can cause premature degeneration of those joints because you've got so much pressure on it for so many hours at a time. And so laying directly on your side makes no sense at all. It's not anatomically correct. We are not intended to sleep like that. I don't care how many pillows you brace yourself up with or how soft your mattress is, it's not good for your hip joint and it's not good for your shoulder. Additionally, women who have a wider angled pelvis, they're more apt to develop trochanteric bursitis. So you have these burses that lay outside the greater trochanter of the femur, and again, if they're putting pressure on those burses throughout the night, they're going to start developing hip joint pain or hip pain that wicks down the iliotibial band all the way to the knee sometimes, and that's trochanteric bursitis. Another don't is don't put your knees directly together. I'm not advocating you put a pillow between your knees, because you don't need a pillow between your knees either. You're going to just make sure that when your one knee is farther forward or back than the other one, because if your knees touch directly and you have the medial condyles of the femurs touching each other, what can happen is you could start developing medial knee pain, or you could develop irritation of the medial collateral ligaments and or the adductor tendons in the inside of the knees. So we need to protect the inside of the knees by not having them put pressure on each other throughout the night. Do's of sleeping is you do want to have rotation of the spine. Your shoulder should be rotated either forward and your hips back. The other thing is when you sleep on the right, your heart is more positioned to your left, and the apex of the heart comes out towards the left, about the fifth intercostal space. If you're laying on the left side, your lungs would apply pressure more to the heart. And so again, it's not it's not the best position to be in as far as taking pressure off of the heart. So sleep on your right side. It's better for stomach emptying, and it also is better for your heart. When you're taking things or medications that make you sleep, and a lot of people take sleep meds, and that's pretty common, but sometimes, depending on how hard they knock you out at night, they may not be the best thing for your sleep. So even though you may be sleeping throughout the night, you may not be moving around very much. Pain medications and or sleep medications may knock you out so much that you're not moving. You literally wake up in the same position you went to bed in, and that is a bad thing to do. The first position I'm going to show you is one that I find most comfortable for me, and that is laying on the back of the shoulder with my hips rotated so that I'm laying more onto the front of my hip. So the back of my shoulder, front of my hip. I'm not laying directly on the side, and my spine is rotated. You'll notice that in this particular sleep position, the knee is pulled upwards. Now, positioning the knee up, drawing the knee up, what it does is it helps counterbalance you, but also how far you pull your knee up and down is going to determine how much rotation is going to happen at different segments of the lumbar spine. So if your knee is drawn up really high, you're going to rotate the lumbar vertebrae at different segments than if your knee is positioned lower, it's going to rotate other segments of the lumbar vertebrae. These next two positions are not really focused on rotation, but they are sort of alternatives to sleeping directly on your back or directly on your stomach. So the first one, you're laying more onto your chest, and the other one you're laying rotate more onto your back, and there's not as much rotation happening. Now in both of these positions, be it you're sleeping more onto your stomach or you're sleeping more onto your back, the critical thing that you see here is how the leg is drawn up and the knee is bent. That helps rotate your pelvis some, so that again, you shouldn't have to have a pillow either under your knees or under your stomach. The last position I want to mention is the fetal position. It's a very comfortable position to be in because it stretches the spine forward. It keeps you warmer because you're pulled in more, and it's put your hips in full flexion and it puts your knees in full flexion. So that's really good to help stretch out your hips and open up the knees to be in a fetal position. Now I know many of you may think of sleeping like that to be complete nonsense, and maybe so. Maybe that's just not comfortable for you, especially for a lot of people who maybe they're developing arthritis in their ankles and they can't fully plantar flex their ankles that way. But it's still a comfortable position to do maybe before your feet hit the floor in the morning. Lay in the fetal position just for a few minutes to open up those hips really well, fully flex those knees, and really stretch the spine out before you get out of bed in the morning. Well, that's all I have for you in this video. Just remember, if anybody's trying to sell you these expensive pillows, I don't even recommend you use a pillow. If you do, use something thin and small. If someone's trying to convince you that your spine needs to be perfectly straight, tell them it's a bunch of quackery. That is not the way you're supposed to sleep. As far as buying a mattress goes, I know it's about what you're comfortable in. But if you get used to sleeping in rotated positions and you're not putting pressure on your joints, you could sleep on an extremely firm mattress. You could even sleep on the ground, and you will be comfortable because you're not going to be putting pressure on those joints. Well, that's all I got for you today. Thank you.
We at MedQuacks are not endorsed or compensated by any drug or device companies. Thank you for listening.